Hello, I'm Professor Rob Middleton at Bournemouth University. The Orthopaedic Research Institute at Bournemouth University has been working with the Royal Bournemouth Hospital and Poole Hospitals to support patients with osteoarthritis during the coronavirus crisis. We've produced a series of 7 videos that explain about osteoarthritis and the simple things you can do at home to relieve your symptoms. I hope you enjoy these videos.
So, on to nutrition and diet. This area is a very contentious area, it's very broad. However, we do believe that excessive weight can put potentially more force and pressure through the joints, particularly of the lower limb, but also being overweight can affect systemically how bodies work, which may cause more systemic inflammation and cause more problems associated with osteoarthritis. It's really important that we have a balanced diet that combines different types of food intake for our health. If we can, reducing cholesterol is beneficial. People with osteoarthritis are more likely to have high blood cholesterol. And it's also important to recognise that diet and nutrition will have an effect on systemic inflammation, as I mentioned earlier, and eating enough antioxidants, which include vitamins A, C and E, may help prevent further joint changes associated with osteoarthritis. The NICE guidelines for weight loss include a balanced diet, which essentially needs to be combined with exercise. It's important that you lose the weight, if you need to lose weight, steadily, no more than 0.5 or a kilogram per week. People with certain medical conditions such as type 2 diabetes, heart failure or uncontrolled hypertension or angina should check with their GP or healthcare professional before starting a weight loss program. There are examples of weight loss programs on the NHS, on the internet. You can have a look at the NHS website, and they provide some really useful guidelines and assistance with regards to weight loss. What I'm going to talk about now is glucosamine sulfate. Glucosamine sulfate has been used for some time as a supplement to help the cartilage structure, and in some cases it's used to alleviate symptoms. NICE guidelines report limited evidence for the use of glucosamine and do not recommend it as a treatment. However, anecdotal evidence suggests that there are groups of people that it does work for, and there's a very low risk profile of it, so it may be worth giving it a go. Essentially, the glucosamine comes from shellfish, animal bones, bone marrow and fungi, and it's important to take about 1,500 milligrams per day if you're going to take it. Chondroitin is another dietary supplement. It's found in the body but can decrease with age or presence of osteoarthritis. It's usually sold with glucosamine. And again, there's very limited evidence to show that it's useful for the population studies. But there is some anecdotal studies again that suggest that it may be helpful, but it's not captured within the research. Again, that's represented in the NICE guidelines, as they don't recommend the use of taking chondroitin as a core treatment for osteoarthritis. Cod liver, oil, cider vinegar and other food supplements have been, again, anecdotally suggestive of reducing pain associated with osteoarthritis. Large-scale studies haven't really shown that it's been that effective. However, again, because these supplements have a low risk profile, it's very reasonable to take them, and if they work for you, then that seems absolutely fine.